In today's modern world, it's common to find people taking medications for various health conditions. But do you know what happens when you mix alcohol with these medications? That's what we will explore today. When it comes to our health, knowledge is power. And one of the most essential pieces of knowledge we should have is understanding the interaction between alcohol and medications. In the hustle and bustle of life, it's easy to overlook the small print on medication labels, but this small print can be life-saving. You see, alcohol can interact negatively with a wide range of medications. This includes not only prescription drugs, but also over-the-counter medications and even herbal supplements. The cocktail of alcohol and certain medications can lead to adverse reactions, overdose, and in severe cases, even death. Quite a sobering thought, isn't it? The risks are manifold. Mixing alcohol with medications can result in a range of side effects from drowsiness and dizziness to impaired motor control and difficulty breathing. In some cases, it can cause liver damage, stomach bleeding, and changes in mental health status. So it's not an overstatement to say that understanding the interaction between alcohol and medications is of paramount importance. It's crucial to read medication labels thoroughly and, most importantly, to consult with a healthcare provider before consuming alcohol while taking medication. Your healthcare provider can provide personalized advice, taking into account your health history, the medication you're on, and other factors that might influence the interaction. Remember, it's not about instilling fear, but about promoting awareness and responsible behavior. Because at the end of the day, it's your health on the line. So just like oil and water don't mix, alcohol and certain medications don't either. Let's dive deep into this topic. Let's begin our exploration with prescription drugs. These are medications that your doctor prescribes for specific health conditions. Prescription drugs are designed to treat various ailments, from mental health issues to physical conditions. However, when mixed with alcohol, the results can be more than just a cocktail of chemicals in your body. They can be downright dangerous. Take antidepressants, for instance. These medications work to balance the chemicals in your brain to help manage symptoms of depression. However, when combined with alcohol, they can cause increased drowsiness and dizziness, and even intensify feelings of depression and anxiety. The story is similar with diabetes medications. These drugs help regulate blood sugar levels, but alcohol can interfere with this process, leading to dangerously low or high blood sugar levels. Moreover, alcohol can stimulate appetite, making blood sugar management even more challenging. Then, we have hypertension medications designed to keep your blood pressure in check. But add alcohol to the mix, and it can cause a sudden drop in blood pressure, leading to dizziness, fainting, and in severe cases, organ damage due to reduced blood flow. Prescription drugs are powerful, and they're prescribed for a reason, to help manage and treat specific health conditions. But when alcohol enters the scene, it can turn these life-saving drugs into ticking time bombs, causing adverse reactions ranging from mild discomfort to life-threatening conditions. In fact, the side effects can run the gamut from drowsiness, dizziness, impaired motor control, difficulty breathing, liver damage, stomach bleeding, to changes in mental health status. Each person's reaction could be different, depending on their overall health, the type and amount of medication, the quantity of alcohol consumed, and other factors. So when it comes to prescription drugs, it's best to keep the alcohol away. It's not just about ruining a night out, it's about protecting your health, ensuring your medications work effectively, and preventing unnecessary risks. Always consult with your healthcare provider or pharmacist if you have any doubts or questions about drinking alcohol while on prescription medication. Now let's talk about the medications you get over the counter, the ones you take without a doctor's prescription. Even without a prescription, over-the-counter medications can be potent, and when mixed with alcohol, they can pose significant risks. Take cold and allergy medicines, for instance. They might seem harmless enough, but combine them with a pint or two, and you could be inviting drowsiness, dizziness, or even impaired motor control. Your body's ability to react could be compromised, making everyday tasks like driving or operating machinery a potential hazard. Then there are sleep aids. On their own, they help you drift off when counting sheep just doesn't cut it. But throw alcohol into the mix and you might find yourself more than just sleepy. Over-sedation can occur, leading to difficulty breathing. In severe cases, it could even result in a coma or be fatal. Pain medications too can be a ticking time bomb when paired with alcohol. Both substances can put a strain on your liver, and when consumed together, they can lead to liver damage. This combination can also increase the risk of stomach bleeding, a serious condition that requires immediate medical attention. The risks and side effects of mixing over-the-counter medications with alcohol are not to be taken lightly. Yes, these drugs are readily available, but that doesn't mean they're harmless, especially when alcohol is involved. Even if you've done it before without any apparent ill effects, remember that the body's response can change over time. What didn't cause a problem yesterday might well do so today. It's always better to err on the side of caution. If in doubt, seek professional advice. Your pharmacist or healthcare provider can guide you on the safe use of over-the-counter medications, especially when it comes to consuming alcohol concurrently. Remember, just because you can buy it over the counter doesn't mean it's safe to mix with alcohol. Even herbal supplements can pose a risk when mixed with alcohol. Let's find out why. We often think of herbal supplements as natural, safe alternatives to traditional medications. However, it's essential to remember that just because something is natural doesn't mean it's risk-free, especially when mixed with alcohol. Just like prescription or over-the-counter drugs, herbal supplements can have potent effects on the body. They can affect how our bodies process alcohol, leading to unexpected and potentially dangerous interactions. For instance, some herbal supplements can slow down the liver's ability to break down alcohol, causing it to stay in your system longer and intensify its effects. In some cases, mixing herbal supplements with alcohol can even lead to severe reactions. For instance, St. John's wort, a popular supplement for depression and anxiety, can enhance alcohol's depressive effects, leading to increased sedation and potentially dangerous decreases in motor control. Valerian, a common herbal sleep aid, can also interact negatively with alcohol. When combined, these two can cause excessive drowsiness and even slow down your breathing, posing serious risks. Then there's ginkgo biloba, often used to enhance memory and concentration. When mixed with alcohol, it could increase your risk of bleeding. And those are just a few examples. The world of herbal supplements is vast, and the potential for harmful interactions with alcohol is equally extensive. Even supplements that seem harmless, like chamomile or peppermint, can interact with alcohol in unexpected ways, leading to adverse effects like increased heart rate or lowered blood pressure. So the take-home message here is clear. Even though herbal supplements might seem like a safer, more natural choice, mixing them with alcohol can still pose serious risks. It's crucial to talk to a healthcare provider about any supplements you're taking, especially if you plan to consume alcohol. So even with natural supplements, it's best to keep the alcohol at bay. There are other medications too that might not seem obvious, but can have negative interactions with alcohol. Let's dive into some of these less obvious examples. Cholesterol-lowering medications, for instance, can have their efficacy reduced when combined with alcohol. This is because alcohol can increase the level of triglycerides in the blood, counteracting the medication's purpose. So, for those on statins or other cholesterol-busting drugs, a pint or two might not be the best idea. Now let's talk about medications for enlarged prostates. These drugs can cause dizziness and fainting, especially when you first start taking them. Add alcohol to the mix, and these side effects can be significantly amplified, making it a potentially dangerous combination. Moving on to ADHD medications. These drugs are stimulants, and when mixed with alcohol, they can mask the effects of drunkenness. This might lead to drinking more than intended, increasing the risk of alcohol poisoning. Arthritis medications aren't safe either. Non-steroidal anti-inflammatory drugs, or NSAIDs, can cause stomach bleeding, and alcohol can exacerbate this risk. So if you're taking medication for arthritis, be aware of this potential issue. Seizure medications and alcohol are another risky pair. Alcohol can increase the sedative effects of these drugs, leading to excessive drowsiness and even breathing difficulties. Moreover, sudden withdrawal from alcohol can trigger seizures in people who are prone to them. Finally, let's touch on antibiotics and other medications for infections. While not all antibiotics have adverse reactions with alcohol, some can cause severe nausea, vomiting, and rapid heart rate when mixed with alcohol. It's always best to err on the side of caution and avoid alcohol when on any kind of antibiotic treatment. So, as you can see, the list is long and the risks are real. It's best to stay safe and avoid mixing alcohol with these medications. Well, let's now answer some of the most common questions people have about the interaction between alcohol and medications. One of the frequent questions is, can I drink alcohol if I am on antibiotics? The answer is not straightforward. While some antibiotics may not interact negatively with alcohol, others like metronidazole, tinidazole, and Bactrim can cause unpleasant side effects if mixed with alcohol. These may include severe nausea, vomiting, rapid heartbeat, and even a reaction similar to a severe allergic reaction. Therefore, it's always best to play it safe and avoid alcohol when on antibiotics. Another question often asked is it safe to have alcohol after taking pain medication? This depends on the type of pain medication. Over-the-counter pain relievers like aspirin, ibuprofen, and acetaminophen can cause stomach bleeding and liver damage when mixed with alcohol. Prescription pain medications, especially opioids, can cause severe drowsiness, dizziness, and even risk of overdose when combined with alcohol. So, it's advisable to avoid alcohol when taking any kind of pain medication. A more general question is, if my medication doesn't mention alcohol, can I drink? Remember, even if the medication packaging doesn't explicitly warn against alcohol, it doesn't mean it's safe. Alcohol can alter the effectiveness of a drug or increase the risk of side effects. Always consult with a healthcare provider if you're unsure. Lastly, can I drink if I'm only taking herbal supplements? Many people think that because these are natural, they're safe to mix with alcohol. However, even herbal supplements can interact negatively with alcohol, causing side effects like drowsiness, dizziness, and even liver damage. So, the next time you reach for that glass of wine or beer, remember to think about the medications you are on. Your health and safety come first. We have covered a lot of ground today, discussing the potential risks of mixing alcohol with various medications. We've delved into the interaction of alcohol with prescription drugs, highlighting the potential for adverse reactions, overdose, and even death. We've explored the risky combination of alcohol and over-the-counter medications and how even seemingly natural choices like herbal supplements can pose dangers when mixed with alcohol. We also touched on a wide array of medications that should not be mixed with alcohol, including those for mental health, diabetes, allergies, hypertension, sleep disorders, pain management, stomach issues, cholesterol, prostate enlargement, ADHD, arthritis, seizures, and infections. The side effects can range from drowsiness and dizziness to impaired motor control, difficulty breathing, liver damage, stomach bleeding, and changes in mental health status. We wrapped up with some common questions about alcohol and medications, underscoring the importance of reading medication labels thoroughly and seeking professional advice if there are any concerns. Remember, when in doubt, always consult with a healthcare provider. Stay safe and take care of your health.